Brighton, Lusaka, a distance of more than 7,900 kilometers. And yet, the truth is nearer to Professor Sir Eldred Parry's statement than it is far.
So the Brighton-Lusaka Health Link has been a collaboration initially, which started around 2014 with the University Teaching Hospital, and then it became a partnership with the pharmacy activities in 2016 when there was a memorandum of understanding that was entered into by tripartite institutions, the University Teaching Hospital, and the University of Zambia through the Department of Pharmacy, and the Hospital Pharmacists Association of Zambia. That was on the Zambia side. And then in the UK, we have partners at the University of Brighton, University of Sussex, and then the Brighton Sussex Medical Universities that are based in Brighton.
We had 6 pharmacists visiting Lusaka, trying to see what kind of products we could develop. And 6 pharmacists from Zambia came to Brighton to see how we provide services.
The Brighton-Lusaka Health Link partnership has mostly focused on strengthening or championing the role of pharmacists in antimicrobial stewardship. So this activity has been born out of the realization that pharmacists have a critical role to play in safeguarding the efficacy and effectiveness of antimicrobials. As we know, the world currently is facing this huge burden of antimicrobial resistance.
In response to the pandemic that is now being reported to have killed more than 4.5 million people globally, a group of local pharmacists through the Brighton-Lusaka Health Link went to battle against COVID-19 through an innovative and responsive idea.
As part of the antimicrobial stewardship, when we zero in into infection prevention and control, we're talking about having, hand sanitizers that are very cardinal in the prevention of infection. So we went into the production of alcohol-based hand rub.
The alcohol hand rub is being used as an infection prevention control by various health workers throughout the University Teaching Hospital, and is appreciated by the staff who have not been spared by COVID-19's trial of destruction.
Our staffing became very bad in such a way that most of our workers actually contracted the disease due to lack of or limited sources of PPEs.
When COVID came, there was the creation of some extra wards. So those wards, they needed some nurses. So from the already area where there was a deficit, they had to pull some nurses.
During this COVID pandemic, I actually lost my father.
And when it comes to the family, they were really scared for me. They thought I would contract the disease. One way or another, I did. I got cured, I was okay.
We always have supplies of the hand rub. Even when we don't have hand soap, we know that we are protected.
What assurances are there that the hand rub is safe? And what are its benefits over the ones sold in shops?
Production of this hand rub locally at this institution is cheaper than buying the readily made, commodity. We conform to WHO, standards. Before we begin to produce the product, first we undertake tests of the ingredients themselves. So we have to ascertain the quality of the products we are starting with, the ingredients we are starting with. And after manufacturing again, we subject our end product to quality control measures.
It makes me feel comfortable. I'm actually at peace because at least I'm able to hand rub my hands even without washing. Yes, I know that I'm safe.
The team at the University Teaching Hospital in Lusaka have scaled up the project by training colleagues at other health facilities.
We've trained Levi Mwanawasa Teaching Hospital. We've trained Kitwe Teaching Hospital. We've trained also Livingstone Teaching Hospital.
So our colleagues also in Brighton found that initiative to be very progressive and very innovative in the use of pharmacy skills.
And together with my colleagues of the Brighton-Lusaka Pharmacy Link, we discussed that actually the way the Zambians showed us how to produce hand rub, that could be copied here in Britain, and we went to the local university because it does need the skills of scientists to make it.
And they replicated the initiative to be able to start producing hand rub at the Brighton Sussex Medical Universities. And we have pharmacists also able to do that initiative there as well.
The role of a pharmacist cannot be overemphasized. It is cardinal if we are to achieve positive national health outcomes.
We feel that this is the opportune time and situation that we are in where pharmacists' role and responsibilities can be further enhanced to contribute positively to the antimicrobial resistance fight.
Now, our desire is to cascade this initiative to the provinces, and if there will be resources, even to the lower levels of the healthcare system.
I think that is the message that we are bringing to the table as the Brighton-Lusaka Health Link, to also appeal to other potential partners that may want to work with us in this particular area to strengthen antimicrobial stewardship capacity of Zambia and also our partners in Brighton.
Collaborations between the global north and south are key to developmental and social growth that would see Zambia achieving its goal of becoming a middle-income country as enshrined in Vision 2030.
North-South partnerships or relationships, we call them, are of mutual benefit in this case on our side as Zambia, because we're on a development path as a country, and we need to establish strong partnerships that are able to help us to link up with other countries or other sectors that have already developed before us, to be able to learn from them how they've achieved certain milestones in their developmental trajectories and translate some of those milestones on our development path.
What I want to do is to take this opportunity to thank our partners for coming to our aid and ensure that this production begins to take place at our institution, because we've seen a lot of benefits as an institution. We've also seen a lot of benefits in terms of preventing the spread of COVID-19.